Hi, good afternoon, everyone. We're just going to wait a few more minutes to let some more people come in. We had a lot of registrations for this webinar. Apparently, it's a very hot topic today, so if you just give us a couple more minutes, we'll be right with you and we'll get this thing started. In the meantime, if you have any questions that you want answered that are burning, that you want us to cover while we're going over our presentation, please feel free to type them in over on the right. Otherwise, we'll get started in just a few moments. Thank you for attending. Okay, good afternoon, everyone. We're going to go ahead and get started. To answer Jody's question, yes, the slides from this presentation will be available after the webinar. We'll have our contact information at the end, so please feel free to email any one of us, and we will send that over to you. I don't like to fill people's inboxes with emails, so if you do want the slides, please feel free to reach out. And again, we'll repeat those contact names and information at the end. So let's get started. Today we're going to do it a little bit differently. We have a panel, so I will be directing my two experts through the presentation. That would be Jonathan and James, so Jonathan Soul and James Meisner. The agenda today is a basic introduction. We're going to be talking about active shooter, but we're not going to be getting too much into detail of the violent nature of this topic, because it's really going to be more of a business directive, how we need to react as businesses, hospitals, schools, and the nature of how this impacts organizations like yourselves, and the steps that we can take to prevent, mitigate, and respond to these situations. So we'll be talking about the uniqueness of active shooter response plans, their plan components. We'll talk a little bit about the differences. I'm sure some of you that work in hospitals or schools understand that they are much more complicated than a small to medium business. So we won't be getting into too much detail. There's a lot of information out there, but we can certainly work with you on an individual basis, provide you additional resources specific to your industry as well. We'll talk a little bit about drills that should be a part of your plan, regardless of the industry that you're in or the facility that you're in. Drills are obviously a very important step to practice the components of your plan and make sure that they are effective. Then we'll talk about a few additional steps that you can take to prepare your staff in your facility, and then we'll have an open discussion at the end to where you can ask questions and get some information and provide us with some information to help you and to support you. Our mission, number one, I won't read this out to you, but really our main goal as an organization is to keep you and your employees safe. There are a lot of companies out there that don't have an active shooter response plan. And the reason is because as this has been a growing threat, there's still kind of that underlying idea of it can't happen here, it won't happen here. I'm sure, as you all know, that's changing. So we plan on helping companies and organizations keep up with the ever-changing nature of these threats. They could be employees, they could be, they're no longer considered maybe a terrorist type of thing. A lot of times it's domestic violence spilling over into your organization, or the nature of, the people that come into your facilities. It's very unique to your facility and your organization. So we try to partner with you and create a plan and help you implement and practice that plan so that we can keep everyone safe. About our panelists real quick, we have Jonathan Sowell. Say hello, Jonathan.
Hello.
Jonathan is our main instructor. He helped us put a lot of the information together to create our general active shooter response training, as well as he's done a lot of training for organizations that we have customized as we've gone. So we dig deep into this. We research this on a daily basis. We improve and update our materials on a daily basis. Nothing we do is ever cookie cutter, and we're always improving and increasing our information that we get out to the public. James Neeser is a little newer to our staff, 14 years in the Navy. These gentlemen are both Navy trained and very much passionate about training and safety and getting this information out and making sure that they are having an impact on their community. We're all very passionate about this. So let's start out with how this impacts you as an individual within your workplace. Has anyone here had a violent or potentially violent incident occur in your workplace? You can take the poll. The poll's up on the screen now. Just answer yes or no. Just want to get a feel for how much of an impact this has had on you as an individual. It doesn't have to be the workplace you're in now, but just kind of wanted to get some numbers to see where we are on that. If this has been something that you're concerned about or has had an impact on you.
If you are saying yes and you'd like to share with us your thoughts or what happened specifically, please feel free to put those in the questions area, and we'll take a look at those as they come in.
Waiting on a few more answers.
Okay, so 38% said yes and 63% said no.
Well, that's great news. A lot of times when I speak to companies and schools and hospitals, there's always been something that's been a concern to them. If you watch the news, these numbers are increasing, so the likelihood of this occurring to you or a loved one or someone close to you is on the rise. But it's great news that you are working hard to be prepared. Obviously, you're here, so you have an interest in keeping your workplace safe. Prevention is number one. We'll talk about that over and over again. Our goal is to prevent these situations from occurring, so that we increase those numbers, so that 90% of you are saying that you've not had an incident occur in your workplace. Because through training, through employee assistance programs, through HR intervention, and really just through a really good program for employees to watch out for each other and report situations that are potentially unnerving. That really helps prevent from from the very beginning. If HR has a solid program for interviewing and background screening, that increases the likelihood that it won't happen in your workplace as well. So those are part of our goals to help you prevent these situations. How many mass shootings, which a mass shooting is defined as more than 4 victims injured or killed, do you think have occurred in 2017 so far? So we're in March, we're at March 9th. Out of those numbers, how many incidents do you feel have occurred so far? Just take a quick guess. There really aren't any. I mean, there are wrong answers, but there's a reason we're asking this question. So if you wouldn't mind, just make a selection. And Jonathan will let us know when everybody's responded. And again, if you have specific questions, please at any time feel free to put them in the question window over the right. Jonathan?
Yep. All close. 42% said 8, 17 said 18, 13 said 25, and 17 said 39, with 13 rounding out at 62.
So 13% said 62?
Mm-hmm.
Unfortunately, 62 is the right number to date. As you can see, they're kind of spread out all over the country. Typically, when we look at these numbers, the Midwest has a lighter incidence. A lighter number of incidents occurring, mostly on the West Coast, East Coast. Northeast usually has heavier numbers, and somewhere around Texas, unfortunately, has a very high number traditionally. So as those numbers grow throughout the year, obviously we're looking, the Gun Violence Archive website on the bottom left, as you can see there, has a lot of great information when you're looking at these situations and trying to see what the reality of this is. Yeah, Jody, just in the U.S., unfortunately. Just in those areas that are on the map. So the reason that some of those numbers, the reason we start with light numbers or low numbers and work our way up is because most of the incidents that you hear about are in the either heavily populated areas, so they get larger press because there's more press agencies in New York and Los Angeles and Washington and Florida even. But the ones you hear about are the ones that have the greatest impact. So schools, hospitals, large organizations, well-known organizations, but the ones that you don't hear about are in the average workplace. So as you can see, they're kind of spread out all over the place, but those are the astounding numbers so far since we're only in the 3rd month of the year. Yeah,
and last year alone we had over 300 incidents in the U.S., and that's just the U.S. alone.
Yeah. And that's, again, it's 4 or more people injured or killed. So these aren't your just average everyday wife shoots husband in, in a home-based domestic violence incident. These are in the workplace. Open spaces, you can see here we break the numbers down. Where these incidents have occurred, 45% occur in commerce. About 76% happen in the workplace, but these workplaces are broken out by commerce, 45%, schools, 17%, universities, 8%, open spaces, public parks, places like that, 9%, and government, 10%. Residences, 4%, house of worship, 4%, which if you watch the news, it sure sounds like houses of worship are impacted more than 4%, but again, that's the media coverage, and that's, those are the ones that have the highest impact because of the nature of their, of their attendees and their facilities. And then healthcare facilities, 3%. So 69% of incidents end in 5 minutes or less. These situations end very quickly. That's why preparation and planning and practicing is incredibly important. If you only have 5 minutes to react, muscle memory is very important. So training your people, repeatedly training your people and your employees and your staff, and then doing active shooter drills so that they know immediately what to do, like the stop, drop, and roll that kids learned back in the 70s, not to date myself, but that's something that's very specific, it's very targeted. When the Columbine shooting happened, that's basically what they did. They stopped, they dropped, they dove under desks. What they were responding to was an earthquake, essentially, because that was the way that they'd been trained for disaster preparedness. They'd been trained to drop and get under the desk. Unfortunately, that caused a lot of fatalities in that situation, and that was the number one reason that these incidences have been investigated, and we've done a lot of research on them, because that really changed the way we look at active shooter incidents. 43% of incidents ceased before law enforcement arrived, and 13% of incidents ended with an unarmed citizen successfully disrupting the shootings. So the people that say, and I don't know how everyone feels about guns, so I'm going to say this the only way I know how. A lot of people say if the good guys have guns, then that will solve the problem. That's not necessarily the answer. As you saw, there are a lot of incidents that happen in Texas. Texas is a right to carry state, so that's not always necessarily the cure. The cure is training and self-defense, and getting people up to speed on what they can do, whether they're armed or not. So we're talking about risk assessments now. I'm going to bring Jonathan and James on camera so we can start getting them involved in the conversation. I've heard enough of my own voice now. And they are the gentlemen who are going to be responsible for doing risk assessments. They've done several risk assessments. So they're going to talk a little bit about why a response plan always starts with a risk assessment, and what the evidence of that risk assessment will do to help you start preparing your active shooter emergency response plan. So I'll start with you, Jonathan. Can you talk a little bit about what a risk assessment is and why it's necessary?
Yeah. For risk assessments, we typically look at different areas of vulnerability around your business. And specifically cameras, whether doors are typically left unlocked, whether people can tailgate. And tailgating is where you might have an RFID or a contact badge, and someone's able to follow someone in without swiping the badge or entering their own credentials to get into the building. And then we also look at the dynamics around the building too, because it's not just the building that takes part in risk, it's also the culture around the building. So is it a high crime area? Is it a high area of homeless population? There's a ton of different aspects we look at. Specifically, when we go in and we do risk assessments, when we look at the components, I go in, or we go in, and we look at the site features first. So we want to know the building itself, locks, we want to know security cameras, is there lighting, ample enough lighting, does the employees and visitors have their own parking spaces? And you might ask why. Well, this is all access control and controlling where people go around your business. So then we look at perimeter design. So is there large shrubs? Is there area between the building and the shrubs? Is there area where people can easily hide past the shrubbed area? And these are all just interesting things we look at. Also fences. Fences are a good one, right, James?
Yes.
So fences, is there a way to control people from coming on site or to bring them in one specific way?
James, what is the number one thing, having worked in the security field a long time, what's the one thing that you feel like facilities fail to take into consideration when increasing the safety or worrying about the safety around the facility?
The number one fail point in my experience is the actual communication procedures. If I've got a maintenance facility person that is working on a door and that information is not shared with the security personnel, I now have a door that's that is not securable due to failure, and is now an entry point, and any kind of student or facility person or worker within that environment is going to know this, but the security detail that is normally on site at the evening did not see that maintenance person working on that door without the complete.
So there's probably a protocol and a rule about doors being open or accessible, but it may or may not have been communicated to everyone. And the second step would be to communicate what the process is when something like that occurs and who to communicate that to, right?
Yes.
Okay. Excellent. Does anybody have any questions about risk assessments before we move on? If you do, we can always work our way back and we can address those again towards the end. The number one question is why? Why create an emergency response plan to begin with? Obviously, there are rules and regulations regarding emergency response plans. Again, it's really shocking to me the number of companies that I talk to that don't have an emergency response plan in place. I spoke to a hospital the other afternoon in Arizona that had 0 emergency response plan set up. And Arizona obviously has different rules than California. California guidelines are very strict. But I was really taken aback by the plan that they had in place. Was really just find the biggest guy and get him to come help in case something bad happens. So there are OSHA guidelines for schools. Obviously in California, there are very direct guidelines on how to put together an emergency response plan and what should be involved in that emergency response plan. So we'll talk a little bit about that as well. And medical facilities, obviously, the OSHA Act of 1970 to assure safe and healthful working conditions for working men and women by authorizing enforcement of the standards developed under the Act. They essentially put into place the guidelines to create an emergency response plan. So what is an active shooter response plan? And then we'll move on to how it's different than a general assessment, because and then a general response plan. I have a quick question about assessments. We own over 200 apartment complexes across the country. This is Jody. Will each need their own risk assessment, or is this something we can do for each?
That just depends. If each one is identical and they're structured identically, or multiple ones are structured identically, then yes, we can do one, and then you can implement those exact same risk, those guidelines that we give you back, you can implement those around to each one of those buildings. If they're a little bit different, or if they're completely different, then it does need to be done separately. But there is different ways to do this, okay? So you don't necessarily have to go on site for each one of those. If we understand the same risk is inherent in each one of those areas, then we can work with that. Also, areas, each one of those areas do need to get looked at least crime-wise, so you'll understand what the crime is in the area. And that's something that would take the better part of at least a few days for just one person to sit down and look at the crime statistics in each one of those areas. So in some ways, yes, and in some ways, no. I hope that answers the question, Jody.
She said they're not identical, but they do have some similarities.
Okay.
So some of the policies and procedures could be the same, but.
And something we've done before, instead of doing a physical assessment, we've done more of a virtual assessment where we'll get together with a lot of the stakeholders at each one of the specific locations and send them out a checklist of things to look at. And then they report back what those were, and we get a comprehensive list together of overall security details.
Excellent. Thank you for that, Jody. So what is an active shooter response plan? It's basically putting together policies, procedures, and practices that you can adopt to effectively respond to reports of problematic behavior made under the organization's workplace violence prevention policy. So creating an active shooter response plan starts with the definition of workplace violence and how your organization plans to address that. The goal, obviously, is mitigation, preparedness, response, and recovery. Those are the reasons why you would need to put together a separate active shooter response plan aside from your general emergency response plan. So we want to talk a little bit about what the differences are, right? Because some companies have a plan for fire, a plan for earthquake, a plan for flood. But now that active shooter has become a much more of a threat, much more of a potential threat to your organization. Let's talk a little bit about what's different. So James, talk a little bit about a couple of these bullet points for me and why a company would want to create a separate plan or an annex to the plan that they already have.
An annex. The idea is to actually increase the culture of preparedness. We already, as stated, we have services and facilities that are in place to support us if there's a fire and earthquake. But right now we do not have any facilities that are supporting the security and the response plans to protect the individuals within the unit. So this ongoing threat, creating a unique response situation, is going to require a unique type of training to enable them to protect themselves.
Absolutely. And Jonathan, you talk a lot in our general classes about fight, flight, or freeze. And how that's a different response in this type of situation than it would be, say, in an earthquake or in a fire or a flood. Talk a little bit about that and how you can factor that into your mitigation processes.
Okay. Yeah, so we know that active shooter is on the rise. It's not an if, it's a when and where. So unfortunately, we can't have the culture of not being prepared anymore, and that's why we're here. We want you to be planned and prepared for this. On top of that, some places, yeah, fight, the run, hide, fight works perfectly. It works perfectly, but in places like hospitals and schools, you don't have that option. You can't fight. You can't teach children to fight. You can't run. If you had school-age children running, can you imagine the chaos? And so a lot of it comes down to, with hospitals and with schools, it's all about shelter in place, lockdown procedures. There's a different aspect there too. And then we talk about, in our classes, we talk about the fight, flight, or freeze, because that's the natural human response. So when we get in a stressful situation, our body, it reacts in a certain way. And that way is to either fight, flee the situation, okay, or freeze. And unfortunately, lack of preparedness and planning typically results in employees, children, teachers, and everyone else freezing because they do not know what to do in this situation.
Excellent. Thank you. So let's talk about the first steps to be taken toward creating an emergency response active shooter plan. So, James, can you talk a little bit about the first few in getting the plan started and what to do in order to get this thing going?
Absolutely. The very first initial step is to perform a risk analysis. And once you get the needs and your baseline understanding of what are your security measures and how is your training in place, it's important to understand who is going to be responsible for what. In a university, it's the facilitators, the teachers, the security staff, the local authorities that you have on campus. Within businesses, it's maybe your ex-military personnel or people that have already received additional training and have identified themselves as manager leaders to apply some leadership during an emergency response situation. The aspect of that is intended to create a redundancy so you always have coverage and there's always personnel that are going to be able to be prepared to fulfill that leadership role. That management commitment part is to ensure that each person that is taking on that responsibility, it's almost like being in the exit seat on an airplane. I'm sitting here, I have accepted the responsibility that you can count on me to help everyone get out in an organized fashion. And so we follow that practice to understand that I'm going to take responsibility and support myself as well as my members in escaping or doing whatever it needs to, whatever the situation requires to respond accordingly.
Absolutely. And then identifying other key stakeholders, obviously with hospitals, schools, whether it be public schools, private schools, or universities, there are internal and external stakeholders as well. HR, security, some companies have armed security, some have just security guards to walk the facility or only there during certain times of the day. A legal team, you can always work with a lawyer or a law firm to make sure that your liability is covered. And that you are taking all the steps that you need to in case an incident were to occur. Obviously, you know, your company is at stake or your organization is at stake, your reputation is at stake. So, you know, meeting with an attorney or discussing it with an attorney is always a good idea when you could potentially be liable. Safety and health personnel, if we're talking about hospitals or even, you know, chemical, you know, places where chemicals are or certain types of machinery, safety and health personnel get involved. You can't you know, locked down in a lab where potentially things can get spilled. They can cause even more damage or more injury. So they need to be communicated with as well. And then communicating to your EAP program through your insurance. Contacting your insurance company to see if they have any guidelines for you to be covered potentially by active shooter insurance, which is unfortunately a new reality of the insurance world. But making sure that your employee assistance program is prepared to deal with some of the preventative measures that you're taking within your organization to make sure that your employees are mentally stable and that you are getting them the help that they need to potentially prevent some of these situations from occurring. Jonathan, you want to talk about the last few, starting with defining your goal with the
Of course.
plan?
So the goal. What is the goal of an active shooter program? Well, we want, just like Brandy was saying before, minimize loss, minimize the potential for liability on the company, and also to get the business back up and running, correct? So we have to understand what is the goal. And every goal is going to be different. Every business's goal is going to be different. There's going to have the same key tones to it, but every goal is going to be a little bit different. So you're going to want to define some of those things that are that might indicate there's some workplace violence. Okay, so what are those triggers? We talk about those a lot in our classes because those are the things we can watch out for. Okay, so not only is your plan important for having it down, but why are you creating it in the first place? Well, we want everyone to read it. We want everybody to understand it. Plus, we're going to define our training from this plan. So having these key parts in your risk, your plan and your response plan is going to enable you to train people more effectively.
Absolutely. And defining triggers, that really comes into play. For example, the process you have in place for conducting a termination or a layoff. When you have mass layoffs, that's a very tenuous situation. Reprimands can often trigger someone. So having plans in place for that to support HR, to have 2 people involved when there's a termination, to have a process for escorting them out of the building with a safety component, whether it be a security guard or, just you have to have those programs in place. A lot of times people will just be let go. One person walks them back to their desk. You don't know what could happen in those situations. And also, if someone knows that someone might be a little bit unsettled, if they've communicated that to the manager, who is then potentially going to be in the office with that person, laying them off or terminating them, they need to know. They need to know that there is a risk. So kind of defining that for your organization and letting them know what things that they need to be aware of to communicate up through the chain so that people are aware. Things like taking out what are those? All of a sudden it's going to go right out of my head, but when you go to the police and you ask for a restraining order. Thank you. Restraining orders, that's obviously domestic violence spills over into the workplace in a lot of cases. One, for example, in Seal Beach was a salon where a young woman had sought a restraining order on her husband. He showed up at the workplace. The owner of the salon decided it would be okay because he knew the man and just walked up to him and said, hey, we don't want this to take place here. And unfortunately, 8 people were shot and killed on that day. There was only 1 survivor. So if they had known that that was taking place, the owner probably would have locked the door and called the police. So those things have to be defined, and that process of communication definitely has to be defined.
Yeah, Jody had a question.
Jody, I see that.
So she wants to know, out of the 62 of the shootings, how many of those involve someone from outside the organization? Don't have a specific number for you on that one.
We could get back that.
We can get back to you on that one.
Yeah, I mean, you'd have to break them down by employees versus non-employees, and it's very possible. So workplace violence, sometimes they don't indicate that when the situations occur. Sometimes that information is not available, but we do. Oh, thank you, Jody. I'm sorry. Jody is asking about non-employees. So the answer to that really is you need to be prepared either way. So if your employees are prepared and trained, they can then take that training home to their families as well, so that everyone knows what to do in situations like this. So say you were someone getting their hair done in that salon. Maybe you would have a different response than a person who works there that hasn't been communicated to. They haven't been trained. They haven't received that level of training and situational awareness. So sharing that information, whether it be an employee or not, is definitely important, because as we know, a lot of these situations occur in shopping malls, movie theaters, places outside of the workplace as well. So general plan components, Jonathan, I'm going to have you start with this one. What we try to do is break down the overall things that you need to consider when creating a plan. The first one is just a general plan for small to medium businesses that don't have specific requirements like schools and hospitals. So Jonathan, can you kind of address the components here and maybe elaborate on these a little bit?
Yeah, of course. So the first thing you'll always do in your general plan, your response plan, is do an overview. So that's the purpose. Some really good things and some things I've seen that really increase the buyback for employees is having executive level involved in this as well. So giving their opinion on this is really, really great. There's also some purpose of the plan, policy of the plan, and definitions. And definitions is a really great way to specify things without having to elaborate further down into your plan. So it really helps you get everything in order and not have to repeat yourself. And then the next thing is training. So we have to think about training and when we need to do training. So is it going to be done onboarding? So we have a policy, and a great policy is doing it within 2 weeks, just like any other normal onboarding training. Doing that active shooter training, when they're in that 2-week window. And that's the really great thing about this is you can give them a small introductory piece. So then to start expanding upon the ideas, and then when you get to the quarterly or annual training, that's when they're really going to get more information about active shooter. In some places, we've seen them do a video or a short 1-hour intro into active shooter, and then expanded upon it with a 4-hour annually for all their employees. And also, next is procedures. So what are you going to do? Like we said, every place is different. Every place is going to have different procedures, and we're going to go into those here in a second. But with procedures, are you run, hide, fight? Are you lockdown? What is the procedures itself? And then also, inside of the procedures, there's going to be different procedures for facilitators, for faculty, for your general employees, for your upper level management. Everything's going to be a little bit different. So communication plan, that's another good one. So a communication tree. It's huge because even if you teach your employees how or what to look for, how are they going to communicate that? Okay, so having a communication plan in there. Also, not only, okay, this is your level of how you're going to communicate things up, but also this is who our point of contacts are. Who's our safety officer? Who is our HR representative for this? Who is in charge of the board who's going to be reviewing these policies? Communication. So yes, we talked about communication. We talked about emergency response plans. So, or response teams. So teams are a really great way to put things into place around your organization because you can break it up in different areas. And so maybe you have a first floor, second floor. Maybe you have an east side of the building, west side of the building, north side, and so forth. And you can put 2 or more ERT members on each team. And they can be the point of contact for other people who work in that area. And they can also be the point of contact for making sure things are still secure around the building. So that might be one of their daily things, is just to make sure this is still locked, the lights are still working, that kind of stuff. And then recovery and transition plan. So it's one of almost the most important parts besides teaching and training your employees so they know, is having a recovery and transition plan. So generally, in any kind of business or any kind of school, there's a bottom line, whether that's getting students back into school or it's putting numbers back up on the board. Regardless, there's still some kind of bottom line. That recovery and transition plan is going to outline what to do. And it shouldn't be a brief 1 paragraph. The transition plan itself should be at least another appendix, because anybody, whether it's me, James, anybody needs to be able to pick up that plan and execute the plan, just in case something happens with upper level employees.
Absolutely, and included in the communications plan as well, obviously with an active shooter situation, the alarm or notification process when an incident like this happens or an emergency like this happens. For example, if you have a fire, someone will pull a fire alarm, and people will respond by going through the fire drill that they've been through, and they'll evacuate the building like they've been told and go through the process. Unfortunately, if you were to pull a fire drill during an active shooter situation, that's the same thing that everyone would do. They would run out into the hallway and definitely, put this gently, increase the number of fatalities. So you have to establish a communication system. For example, I heard that there was a hospital that had a notification that went out and said, calling Dr. Strong. And that let everyone in the hospital know that works there, obviously not the people that are visiting, families and friends, but at least the people that work there know how to start putting that into place. James, I think you were the one that told me about that.
Yes, absolutely. Because it's on the same topic with Mr. Brown's question, as far as the reporting procedures,
yes,
that communication process, it's no university is going to be able to follow the HIPAA guidelines. But most universities, and I hope that yours does, and if not, we can provide you assistance in implementing a communication plan, whether it's a blackboard or an internal site that is available through the university where the person that is actually engaged in the restraining order can privately inform the security personnel within the university without violating any HR or HIPAA standards to let them know that it is something that is increasing the risk.
So the answer is they can't necessarily require it, but they can make it available because obviously it's in a student or a teacher's best interest to have a security team notified if they're trying to keep a certain person, whether it be a family member or a friend, trying to keep them off campus. For them to be aware of it is definitely in that person's best interest. So creating that process or communicating that process that they can go through is very important, especially on a university campus where these happen very often. And just to bring up another number, James actually flashed a piece of paper at me. I don't know if you guys saw that, but what was the percentage of?
64% of all shooters have zero connectivity with the businesses that they're performing their violence in.
So that's a large number.
Yeah. And communication, talking about communication and how you're going to respond and how it's going to be alerted to your employees. But we might have hospitals, they'll call code silver, just like they call like code blue and other things inside the hospital, which nobody, almost anybody who works outside of the hospital has any idea of what that is. But it needs to be uniquely different than a fire alarm. Because fire alarms, what do people do? They hear the fire alarm, they get out of their desk, and they start running towards the exit, or they start going to the exit. And so they need to be communicated, like James had said, through either a uniquely different tone, which is can be understood by everyone, or it needs to be communication methods, which could be email, text message, and so forth.
So going a little bit deeper, since we were just talking about calling Dr. Strong, let's talk a little bit about hospitals. I know that I had some hospital employees register for the webinar. So, and we've obviously been communicating with a lot of hospitals and hospital management companies because clearly it's a very vulnerable situation to be in a hospital, whether you're visiting or ill or injured or work there. The numbers are on a very steady increase. Just this last week, I was talking to a community hospital, like I mentioned, in Arizona, and the numbers are just staggering in hospitals and healthcare facilities. Just very recently, the statistics we have are from years past, mostly through 2013, 2014. Unfortunately, over the past few years, they've increased steadily in hospitals. I couldn't answer the question as to why that would be, but it's something that has to be addressed. Now, hospitals, especially here in California, have a very specific guideline for their emergency response plans. I mean, we've seen some that were, 15, 20, 25 pages long, and these were just templates for hospitals to go by. So it depends on where access is established, what areas are cut off to visitors and non-visitors, how many centers there are. A lot of hospitals have clinics and separate facilities. They're all the same employees, but they have very different situations in very different areas. So overview obviously would be very similar, probably much more elaborate, but very similar in a hospital situation. Training becomes a little bit more challenging when you have employees that literally cannot be taken away from their job during working hours. Some work 24, 36-hour shifts. So as an organization, we try very hard to create numerous modalities for employees to receive training. So Jonathan mentioned online training, e-training, courses that are available whenever they can take the time to take them, as well as webinars like we're doing now. We do these for organizations. We have a university webinar coming up in a couple of months to present to students and faculty. So there are a lot of different ways, but you have to establish what the needs are for training, what the obstacles are for training, and how to get this across for training. Jonathan mentioned onboarding. That is probably the #1 best time to really dig into active shooter and your emergency response plan because people need to get comfortable with facilities. And there comes a time where, and I think we all know this, when you work in an office every day, you disregard things around you and you don't necessarily look for changes anymore. You come in the same way, your desk is in the same place, you walk in, say hi to the same people. If you have public in your office, you don't necessarily notice someone that's out of the ordinary because there are people coming and going every day. So that's the best time for people to get acquainted with their facility and get acquainted with your emergency response plan. It's when they're the most open to new information. and definitely a time that you want to take advantage of. So unique procedures and communication plans, Jonathan, if you want to mention that. I know we had talked a lot about PR and how that is involved with media and external.
Yeah. And one thing to note and to add to what you were just speaking about is complacency. So complacency hasn't set in yet when you're first on the job, but after a couple months, couple years, complacency starts setting in. Okay, so there's a paradigm shift, between regular businesses and hospitals, and that is that, well, you can't just run, hide, fight. If it's every man for himself or every woman for himself, who's protecting the patients? Who's protecting our visitors? So in some cases, they can run, they can hide, the visitors can, but who's going to get the patients out? So a lot of it comes down to containment and lockdown, and those also go into very last thing is an all clear. So the containment, what individual areas will have for the responsibilities. So every area, whether it's patient care, ER, or inside of some ward, is going to have a different containment procedure or lockdown procedure. So if it happens here, how are we going to contain the situation so it doesn't spill out to the other parts of the hospital? And then from there, security, how are they going to respond? It's going to be completely different. Lockdown. So can we lock down the other areas of the hospital? So once we have activated that alarm, we now need to lock down certain areas, and we also need to ensure that each area is locked down. Well, who's going to be doing that? So we put these into this plan. This is where it's different. Now, communication plan, I'm talking about PR a little bit, that's huge. Who's going to be notifying everyone outside of the hospital what's going on? So you need to have a plan in place and established with some pre-done or some basic templates for what to say and how to respond to or how to communicate this outside your organization.
Right, and communicating to families who are concerned that they have family members or loved ones that are in the hospital. So also, letting the media know and letting external sources know what's going on, that everything's under control, is really very important. Otherwise, you have people stampeding to the hospital. Exactly,
and then also, well, maybe you're the only ER in the 25-mile vicinity. So where are people actually allowed to go in at that point? That comes down with containment as well. And also notifying people on the outside. If people are still coming, they might be in their cars, they might be on the way to the hospital when this is all happening. Well, how do we alert people once they get to the hospital?
Absolutely. So, and school plans, fairly similar. James, if you want to talk to the uniqueness of from maybe lockdown down through recovery and transition.
Yes, absolutely. The primary process to understand is to understand your purpose. Why are we doing it? What procedures are we going to follow? And what is the policies that were mandated? Inside of the school industry, there's obviously a lot of regulations that you must follow, especially here within California. And when you were able to define those terms, you need to make sure that you understand the definitions of what each responsibility is. We have a lot of faculty and facility members as well as volunteers that are assisting with our schools, especially specifically between the K through 9 age range. It's important that they understand the procedures that the school is going to follow. The PTA needs to understand how are we going to communicate what we want them to do during an active shooter event or any kind of potential workplace violence or faculty and school site violence event within that. If those plans are not communicated effectively, it's just going to create a larger and less constructive preventative measures as well as authoritative measures, meaning that the police officers and any kind of actual security detail that's going to arrive to provide support to that event is going to become less effective because now they have to struggle and fight with just the parents. So if there's not a plan in place and the responsibilities are not properly defined, it creates an actual greater risk to the children, which is exactly the opposite of our intent here. When it comes to universities, a majority of universities already have a internal house communication plan that has been effective, and we love to support that program by enabling them with the understanding that it's actually a tool that can also be used to share indicators. As Mr. Brown had stated with the restraining orders, yes, there are certain sensitivities, but if it's coming from the person themselves, nobody knows the actual campus itself better than the students and the security staff that are present. So our intention is to provide them with the training to enable them to give the support to the actual supportive elements like the base police and the security and teachers and faculties themselves to enable them to be preventative, which is our main goal.
And like I said before, there's a difference between K to 12 and universities. Okay, so K to 12, we don't want children running around. Okay, with universities, we can't force people to stay sheltered in place. We can't force them to stay in certain situations, so they might be able to evacuate. So there's going to be a different procedure there for that as well.
So the underlying kind of the concept to get out of this is, as we stated at the beginning, Jonathan, you said they're all very, very unique. Every business has very different components that they have to deal with, whether they face the public, whether they're open to the public, whether they have very strong security, very weak security. They could have, armed security guards at the front door and feel like they're completely safe until it's someone who's been fired that, attacks from within. So the answer is the very first step is a risk assessment. And in that risk assessment, determining what your obstacles are in implementing an effective and immediate response plan, and then creating that plan around those deficiencies, essentially, or those challenges. So that's why risk assessments are so important in the very beginning. And it's also much better to have, and this is, again, whether you work with our organization or any other organization that's out there, there are a lot of companies that do this. We think we're the best. In fact, we know we're the best at this. But the best part about having an outside organization come in is they're not familiar with your facility, nor would a student be that's coming on campus for the first day, nor would a person that's visiting their mother in the hospital the first day that they come in. So we would see things that you wouldn't because you're there every day. We take things into consideration that you wouldn't really think are an issue because you're there every day, and that's your job. So it's really ours to find holes in that and look at your facility from an external standpoint and find ways that we can help you, help support you in creating a plan that works for everyone, not just that employee that's been there for 5 years. So we're going to talk a little bit about active shooter drills. I know we got a lot of detail on the active shooter plans, and this is kind of just something that takes place after you've put a plan in place, after you've done your training, and after you've tested that response plan. That's essentially what we're doing with an active shooter drill, is after you've gotten everything in place, the drill is really to find holes, the things that you didn't see, determining the behaviors of your employees and how you need to kind of adapt and adjust for those, as well as create muscle memory with your employees and your staff. Jonathan, if you could talk a little bit about this. We did a drill together, and it was very, very surprising, but incredibly effective.
And the purpose of a drill is not to make people cry. It's not to overwhelm people. It's just to get the muscle memory in place and to test out the plan you have. So you want to take it from a logical standpoint. We'll go over how you're going to address the drill and the setup here in a second. But the end goal of any drill is to get those lessons learned. And those lessons learned are valuable because we can put it into an after-action plan. That after-action plan, in turn, is going to set a timeline for these problems to get addressed and to go back into your planning. Because every month, your plan should be put together from people from different aspects of your organization, whether it's training, whether it's education, whether it's HR, whether it's operations. Everyone's going to have a unique perspective to bring to the table. Well, that team is going to review this after-action plan and determine what things need to be put in place inside of the policy. Now, when you do drills, the first thing you do is reviewing the documentation. You figure out who your key players are, who's going to be your active shooter, if you will, who's going to be your it usually is me.
It's a good one.
Yes. Also, who's going to be evaluating? Because we need evaluators. So each active shooter should have an evaluator behind them, and also other people. Yes. And so logistics. Who's going to do the logistics, staffing, layout? And the biggest thing is doing a planning meeting. So you really want to do this at least 2.5 months ahead of time. Have a planning meeting so people can get together and plan this out. Then your formal invitation. So telling people you can opt out or you can be in this training. And then we print documents. Documents are huge too because you got to notify everybody outside of the organization. If you're in a building around other buildings, you have to notify them that you have an active shooter drill going on. When you're reviewing documents in the beginning, that's where you have to get your permits. Sometimes you have to get permits from the local fire and police departments. Okay, so otherwise you can't use simulation rounds, or you can't use airsoft weapons, or you can't use anything. So then after that, you have your evaluation. Your evaluator is looking at what's going on during the drill when you're conducting the exercise, and then we go into the improvement and the after action plan.
Awesome. Thank you, Jonathan.
You're
Does anybody
welcome.
have any questions about drills or risk assessments or getting their plans started? I'm going to talk a little bit about what we do. So if you do have questions, please feel free to type those in while we're going over almost the last slide. So we as an organization, the reason that we do these webinars, again, coming back to our purpose, is we want to get the information out there. We want to support our community first in being prepared so that we don't see these things happen in our community. If we can prevent them, all the better. So the number one way to do that is to do a risk assessment of your facility or your organization. We can assist you in creating an emergency response plan. Again, bringing in an outside party will help you to evaluate the things that you may or may not know are going on around your facility. Again, what Jonathan said about your location is very important when it comes to threat assessment.
It's also a different perspective too.
It is a very different perspective,
Yeah.
and looking at your clientele as well, like
Yeah.
really taking a look at the industry you're in, communicating with you the risk, communicating with you situations that have happened in this area and in your industry and in a facility like yours, so that you can learn from past experience. Obviously, history should not repeat itself, so we spend a lot of time learning lessons from past events and trying to implement them in our processes and in our training. So active shooter response training, obviously that's a given. Like I said before, we do a lot of different modalities, try to get the information out in whatever way will best arm your employees and your staff. Active shooter response for management, again, responsibilities and roles are very, very important when it comes to active shooter response. So training managers on a separate level on how they can attend to their employees, whether it be, if it's in a school facility, we would talk to teachers and staff. If it's in a hospital, obviously we would talk to the different areas in the hospital and provide different training for a nurse versus a doctor versus someone in the finance department. So we put together very customized plans and training. And then active shooter drills. We can come out, we can help you plan the drill, we can implement the drill, we can come out and run around your facility and pretend to be active shooters, and then do a post-assessment with your employees to bring the heart rates down a little afterwards, and collect information that helps you moving forward so that you can improve on the plan that you already have in place. And then the next step, like I said, situational awareness is very, very important no matter what area of the company or the organization you're in. And again, it will help you in a movie theater, it will help you in a shopping mall. This is something that naturally everyone needs. Everyone needs training on how to increase their situational awareness and how that will impact themselves in their environment, wherever that may be. Threat and vulnerability assessments, we can do deeper assessments based on your facility, your location. Verbal de-escalation and self-defense techniques. Obviously on an individual basis, that's very important. If you deal with the public, sometimes people get a little crazy and you don't really know how to react because you're in customer service mode. We do training on that as well for client-facing and public-facing employees. And then we have some specialty courses. Again, just let us know what area of training you need. We'd be more than happy to put together training for you, or resource the training for you and provide you with additional resources. This presentation will be sent to you after the fact. We record this and we send out the recording, as well as place the recording up on our website. So if you want to view some of our past webinars, they are on our website under resources, events and webinars. Or not events and webinars, videos, I'm sorry. Events and webinars show our upcoming webinars. We try to do these at least once a month, if not twice a month. So please feel free again to join another one or view our recorded webinars there. And as I said, this one will be recorded and sent out to you after the webinar. There's James and Jonathan. There's their contact information. The email that goes out will have our contact information as well. Our general number is up on our website, so you have any number of ways to contact us. If you just have questions, if you just have concerns, if something comes up later and you say, you know what, I really should have asked this question, please feel free to reach out. Again, our number one goal is keeping you and your staff safe. That's more important than anything else. We are happy to help in any way, shape, or form to support you and to keep your employees safe and to just be a good resource for you. So if anybody has any questions, please feel free to do so now. If not, you have my contact information. Like I said, you can email us or just respond to the email you receive after the webinar if you need additional information or if you'd like to speak with us directly. I really appreciate everyone taking time out of your afternoon. I understand this is right after lunch, so hopefully we didn't put you to sleep. Try to keep it entertaining, but also give you as much information as possible. So we really appreciate your time, really appreciate your attention. Thank you, Jody, for all your questions. And was it George?
And thank you for caring.
Yes, and thank you for Gerald. Thank you for your question as well. And yes, thank you for reaching out and working on putting a plan together to keep your people safe. All right, we will go ahead and close out, but we'll be here for a minute or two. Happy to answer any questions for you, and have a wonderful day.
Thanks, everyone. I really appreciate your attentiveness, too.